Hi, good day. Welcome back to HistologyPro, my subscriber, my viewers. Welcome back. In today's lectures, we'll examine one of the most delicate and essential epithelial tissue, known as simple squamous epithelium. So, this lecture will be on identifying simple squamous epithelium, the location, and functional relevance. This type of epithelial tissue, known as the simple squamous epithelial tissue, play a major role in filtration, diffusion, and lining surfaces where minimal barrier thickness is required. So by the end of this video, you will be able to accurately identify simple squamous epithelial tissue on histological slides, differentiate it from artifacts, and understand its function and clinical relevance. Looking at the characteristics of simple squamous epithelium, it consists of a single layer of flat scaly cells. In the previous lecture, we defined that simple means it is one layer, squamous means flat. So combine the two definitions of simple squamous, you're expecting that the epithelium is single flat layered cells. It is also defined or described as a cell resemble a fried egg on a flat plate. The cells of the epithelium of this epithelium are extremely thin with a bulging or centrally placed nuclei with little or flattened cytoplasm that surrounds the nucleus. Key features in simple squamous epithelium you should be looking at includes one cell layer, only one layer of cell, flat cells. The nuclei of the simple squamous epithelium appear flattened. As you can see in the nucleus um, in these alveoli. This is a simple squamous epithelium. The nuclei, which is stained blue, is flattened, and that's a tiny cytoplasm. The cytoplasm is stained orange or pink. It's stained pink. It's it has a very thin cytoplasm. Only visible cell border. You can see poorly in this boma caps of the kidney. Poorly visible cell border unless they are stained clearly. Because they are thin, these cells dramatically reduce diffusion distance, making them ideal for gas exchange, filtration, and smooth lining of surfaces. Simple squamous epithelium is found in anatomical sites requiring rapid exchange of friction-free lining. Simple squamous epithelium is found in major locations which includes the alveoli of the lungs. This allows efficient diffusion of oxygen and carbon dioxide. In the kidney, it forms part of the Bowman capsule and contributes to blood filtration. As endothelium, it lines blood vessels, lymphatic vessels, and regulates vascular permeability. As mesothelium, it lines the pleural, the pericardium, and peritoneum. This strategic location of the simple squamous epithelium highlights the tissue's function, which is minimal barrier with maximum exchange efficiency. Let's go deeper into how to identify simple squamous epithelium on slides using H and E stain, also known as methoxylin and eosin stain. In methoxylin stain, nuclei deep purple, deep purple, and cytoplasm appear to be plain or pale pink. This is the effect of eosin. Because the cells are extremely flat, you often see mostly nuclei. You can see, you see in these slides, you see mostly nuclei. because the cells are extremely flat and the cell borders may appear faint or thin. Now let's go to the functional correlation of simple squamous epithelium. Remember, structure always reflects function because simple squamous epithelium is very thin. It allows diffusion, filtration, secretion, and smooth surface. This tissue is essential for maintaining permeability barriers with minimal resistance. Now, looking at the clinical significance of this tissue, understanding the normal histology helps us recognize pathological changes. Beyond its basic structure and location, simple squamous epithelium has significant clinical importance. Damage to this tissue can interrupt diffusion, filtration, and liquid balance, leading to several important disease conditions. We'll be looking at some disease condition. One is atherosclerosis. Chronic injury to the endothelial lining of the blood vessel trigger inflammation, which leads to lipid deposition and plaque formation, which narrows the vessel lumen and impair blood flow. Another disease condition that can occur, damage to the mesothelium causes pleural effusion. This disrupts normal fluid balance or regulation. As a result, excessive fluids accumulate, leading to pleural effusion and some inflammatory conditions. Also, damage to the simple squamous epithelium in the alveoli of the lungs leads to acute respiratory distress syndrome known as ARDS. In ARDS, uh, injury to these epithelial cells or alveoli type 1 cells impairs gas exchange. And also in mesothelial dysfunction, when mesothelial cells are damaged, it loses their regulatory function, loses their vascular tone and permeability. This plays a key role in hypertension, diabetes, and thrombus formation. So clinically, the importance of simple squamous epithelium lies in how its damage directly compromises exchange surfaces and vascular function. In summary, simple squamous epithelium is a thin, single-layer tissue specialized for diffusion, filtration, and smooth lining. Its structural delicacy is closely tied to its critical physiological function. As you continue with histology, always remember to correlate the tissue architecture with its role in the body. Thank you for watching Histology Pro, your trusted guide to mastering microscopic anatomy. Subscribe now if you want more histology explained clearly and simply. Bye for now. I remain yours and only Histology Pro. Bye.